you, Jane. Hi, everyone. My name is Shruti. I'm a postdoctoral research associate on the Inclusivity project. And over the last year, I've been working on this piece of work. It's still an ongoing piece of work, an applied research project that we're doing in collaboration with one of our project partners, Age UK. And I'm just going to tell you a little bit about how far we've gotten and where we see this going forward. It's a very short presentation, and I'll try to get through it as quickly as possible. Next slide, please, Misty. So the aim of this project is to support Age UK, which is one of our project partners, to transition to a hybrid work environment, which was one of their goals at the start of last year in relation to the pandemic, because the pandemic has changed so much the way we work, the way we view work, the way that our work week is, and what we define a work week is. So Age UK was trying to get ahead of the curve, and they wanted some support with facilitating a fair and equitable transition to a more hybrid work culture. And we decided to support them with that endeavor because in all that it's given us, I think the pandemic has given us an opportunity to make work more accessible, more inclusive, and more enriching to our lives by redefining what work means. And so using this opportunity to build back better, as opposed to just build back, is that opportunity exists to make the most of it. The other thing I wanted to just preface what we did with is that hybrid working is still very experimental. Everything that we know about flexible working comes from a research that predates the pandemic. So a lot of it is on remote work, which is not quite the same as hybrid work. Hybrid work is a mix of remote work and office work. So what we know about hybrid work is still very experimental. We don't know what it looks like or how it should be structured. And organizations are just going with the flow. But what we really need is a planned and a systematic approach to navigate this transition. And that's what we're trying to put in place with Age UK, and hopefully stimulate conversations around doing this with other organizations as well. Next slide, please, Misty. So the process that we used was co-design, because I think everybody agrees that co-design is the way to go when trying to attempt a culture change within an organization. So we facilitated discussions with the workforce at Age UK with the aim to co-design a process or a resource. We didn't quite know what it would look like, and I can't say we do, but essentially we knew we needed to get complete participation from the organization in attempting to navigate this transition. So we had approximately 15 participants across 2 discussions. First, to identify what the key issues were in relation to COVID, in relation to hybrid work, and thereafter, we had another discussion to identify potential solutions, because again, we think participation from the workforce in identifying solutions is key to be able to make sure accountability is there in implementing those solutions going forward. Next slide, please, Misty. We found some key themes that I'm going to very briefly touch upon, but we're not saying this applies to every organization, but for the work we did with Age UK, this is what really came up. So there was issues around productivity, connection and social isolation, trust and flexibility, burnout, and team building and support. And I'll just touch upon them very briefly in the next few slides. Next slide, please. So productivity, we found that there was quite a lot of anxiety around evaluations, role progressions, because the issue of visibility really starts to come up when people start working hybrid. There are people that work in the office, there are people that work remotely. So visibility introduces a lot of anxieties around, and this relates to what Dan was saying about unconscious bias around who receives training and development programs, whose outcomes are monitored and measured successfully. Are they in person? Are they at home? So all of this has an impact on who is promoted, who is retained, and who is let go. So the need for more explicit guidelines around how productivity and performance are monitored have come up. Team building and support. Teams don't work as they did traditionally. There's the issue of asynchronous working. So teams have to work together. We can't work in silos if we're working for an organization. So the issue of asynchronous working has really come up. People work at different times, at different speeds and intensity. So that can become an issue for the organization as a whole. And because Age UK is a frontline charity, this is an issue that's quite specific to them in that they do quite challenging work. So in the absence of a traditional office space, the need for debriefing and debriefing support and de-escalation support is missing at the moment. So how to bridge those gaps as well. Next slide, please, Misty. Connection and socialization, I think this is quite obvious. People are quite sick of working from their kitchen tables, from their bedrooms. They want the creative interaction that comes from being with colleagues. And this also has highlighted the dangers around silo working and what this means for both individuals and the organization at large. And not everyone's comfortable around virtual work in social spaces. So how can we make this more accessible for everyone has become a key issue. Burnout is emerging to be quite key as well, because work-life balance is more challenging when you approach hybrid working. And the pandemic has also exacerbated some of the inequalities that already existed, especially for certain groups like women. And there is research and evidence to support this. So work-life balance has become quite an issue. And in the absence of the office space, the lack of access to support, if you're struggling, if you are on the verge of burnout, if you're unable to manage work and home, the lack of access to support because of disability or the lack thereof, again, is an issue. And trust and flexibility. So we want to round this off with how are we making these decisions and how are we approaching this navigation to a hybrid work process, in that everyone thinks that they've had a chance to be heard, that they feel trusted, and that their flexibility that's very personal to them has been taken into account. So just transparency around how these decisions are made with consultation from the workforce is very important. So this is what we found across the discussions that we had. Next slide, please, Misty. So I want to very quickly talk about the way forward. So there was a government consultation that was initiated in September last year, and it closed in December. And this is into the current legislation and how this can be improved, keeping in mind what the pandemic has presented us with, the opportunity to make work more inclusive. As of now, you have to wait 26 weeks to request for flexible work arrangements as part of our existing legislation. So one of the proposals is to make this a day one right. But there are other issues where we can make this a day one right versus a day one request, but that's currently not being considered for legislation. The other thing is there are lots of inequalities now between time flexibility and location flexibility. We're talking about hybrid work, so that very much has become about location flexibility, but we have to acknowledge that flexibility is beyond location, and it's also time flexibility, because CIPD research has found that location flexibility is being prioritized over time flexibility, and time shares and part-time work and flexibility around time has come down quite significantly since the pandemic. But that is also a very important part of approaching hybrid working, in that time flexibility is important. So the way to do this is to start having conversations about equitable access to affordable care arrangements. This has very much to do with the work-life balance issue that are more pronounced for some groups than the others. So policies around equitable access to affordable care arrangements is very important. Digital inclusion should be a priority. With the work that the Inclusivity Project is doing, we've found that digital exclusion is a huge issue, especially for older workers. So keeping in mind that people shouldn't get left behind as we move into hybrid work, because it's so modern and so unprecedented, and it offers so much opportunities through technology. How do we keep everyone involved, and how do we include everyone has become important. And supporting marginalized groups to navigate the transition. Again, there is evidence to show that marginalized groups, especially minorities, women, people with disabilities and long-term health conditions, are more negatively impacted by this push for flexible and hybrid work. So how do we keep in mind their specific needs? This is where this work connects very much to the existing work on the Inclusivity Project around unconscious bias and training and development around that. And also, I think because we work with Age UK, we found that there are issues that are very specific to frontline charities, third sector organizations, not just large businesses, which have teams in place to do this work. So we need to rally around small and medium enterprises and charities and third sector organizations to support them to navigate this transition. So we don't have all the answers, but I think we've identified where the key issues are for this organization, and we've identified a process that we think works, which has to be co-design and consultation with the workforce. That's all I have for now, and I welcome any questions or comments. Thank you.